So this definitely is not a video I thought I would be making at 42 years old. And that's because it took me 11 years to become a board-certified emergency medicine physician. And if you told me 12 years later I would be walking away from that job that I wanted ever since I was a kid, I would have told you that you're crazy and it was not possible. And I have proof of that. This is my high school yearbook. This is a picture of me as a senior in 1999. Yeah, 1999. But I show you this because even back then, people were writing in my high school yearbook best wishes on becoming a doctor because I went around all 4 years of high school telling people that's the only thing I wanted to be. That plus a photographer, but I knew that wasn't going to pay the bills. But the point is, everybody knew I wanted to be a doctor. I knew I wanted to be a doctor. But now, fast forward 25 years later, and a day after I was thrown a can't believe you're actually quitting good luck party, this is me actually working my last shift as a full-time emergency medicine physician. And this video is the story of how I achieved my dreams and then everything kind of went south. That's because I'm actually wired to be an ER doctor. I didn't want to work in clinics. I knew I didn't want to deliver babies. I really wasn't fond of the operating room, and I didn't want to follow people's blood pressures and sodium levels on a regular basis. Plus, whenever I wasn't in the hospital, the idea of not having to worry about my patients, not having to worry about paperwork, not having to worry about insurance or responding to pages because I'm on call really appealed to me. And most importantly, I truly love procedures. I love putting in chest tubes. I love repairing complex lacerations. I love reducing joint dislocations and setting broken bones, or the most fun, stabilizing a patient when they are truly moments away of death and then being able to go tell family members that everything is going to be okay. Even to this day, those things really excite me. But unfortunately, there are two things that I really didn't give enough consideration when ultimately choosing my career path. And it wasn't because I wasn't warned. I remember specifically to this day an encounter when I was in medical school with an emergency medicine physician when I told him that I wanted to be an ER doctor. He looked me square in the eyes. He didn't try to dissuade me, but he asked me one simple question. How much time of the year are nights, weekends, and holidays? And not trying to spend too much time thinking about it, but not trying to sound like an idiot either, I quickly said, well, over half of the time. And he said, that's right. Keep that in mind. Over half the time when nobody wants to be working, nights, weekends, and holidays, you are responsible for being in the hospital. He let it sink in and then he changed the subject. Like I said, he wasn't trying to dissuade me, but he was really trying to make sure I knew what I was getting into. But I didn't really care. I wasn't married at the time, I certainly didn't have any kids, and the idea of pure shift work without having to deal with the healthcare burdens that I mentioned previously still really appealed to me. Even if he had set me down and told me to consider family more than I was, I don't think I would have changed my mind because nothing can truly prepare you for what the impact of marriage and having kids is going to have on you and your priorities. Because when those incredible life events happen, nothing can prepare you until you experience them. Working on Christmas when you're not married and don't have kids is one thing, but when you're walking out of the hospital alone at 2 a.m. on Christmas morning and you see your car is the only one in the parking lot and all of your colleagues in the healthcare setting have been at home, have been with their family, and you're going to end up celebrating Christmas a day or 2 days later because you were working, and then you're pretty much a zombie because you're so tired because you've been up all night on the actual day of Christmas because your body can't rebound like it was when it was younger. It affects you. And those effects are far more profound when you have a family. Now, I truly can't complain. Not only was I warned, but I knew getting into this profession what was required from a time management standpoint as an ER physician. Nights, weekends, and holidays are part of the plan when you sign on the dotted line. But it's kind of similar to planning a vacation at the beach only to have it rain the entire time, and while you're at the beach you think to yourself, man, if only I'd known it was going to rain, I would have chosen a different week. It's kind of a similar line of thinking. There's no way to predict the weather for your future vacation. There's also no way to predict the anguish you're going to feel when you're not there for a holiday, or when you miss your kid's tennis tournament or swim practice, or you're not there to tuck them in at night because you're working a night shift, and how increasingly difficult it becomes because you realize those opportunities are finite, and once they're gone, you're never going to get them back. When you're young, you feel like you can see everything because the reality is you don't really have that much to look at. But as you get older, you realize that all the time you spend on one thing that is important only takes away time from other things that you begin to realize are far more important. Your field of view isn't nearly as wide as you think it is. So that's really only the first line of thinking that's causing my early retirement. The second, and I hate to say this, is the job itself. It has changed considerably over the last decade. These changes were already in place before the pandemic, but oh man, have they accelerated over the last few years. Even as I make this video, I love taking care of critically ill patients. But it is no secret that the burden of the U.S. healthcare system is crumbling, and those effects are disproportionately affecting the emergency departments across the country. And I'll be addressing some of those in later videos. The burden of chronic disease in the United States is unsustainable. And as people become increasingly unhealthy and lack access to basic primary care, they seek care for their chronic conditions the only place they can find them. And that's the emergency department. And that's not necessarily a bad thing. Anybody who needs help at any time should have access to health care, and the emergency department is there to provide it. However, trying to get your health care for your chronic diseases, I tell people all the time, as politely as I can, but it's like going to Burger King and ordering a pizza. Burger King wants to feed you. They want to take away your hunger. They don't serve pizza. Slow chronic healthcare problems require slow chronic solutions, and unfortunately that's not what you can find in an emergency department. When an emergency medicine physician determines that you're not going to die anytime soon, they are going to discharge you without offering you significant help. And it's not because they want to. The emergency department doesn't have the resources to effectively treat these illnesses. And that's really the other half of the coin that was driving me away. I love treating urgent and emergent problems. I still do. But as the U.S. healthcare system continues to implode itself, more complications from these chronic problems like obesity, diabetes, psychiatric illnesses flood the emergency department, and it just can't handle it. And when these chronic problems show up with increasing numbers, they quickly outpace the number of true emergencies that I was trained specifically to handle efficiently. And not only can I not provide adequate care for these patients that are showing up because of the inherent constraints of an emergency department, I was becoming increasingly frustrated by my inability to help them. So when you combine the issues I discussed at the beginning of the video with the healthcare limitations of the emergency departments currently, it's a recipe for decreasing satisfaction. And it just makes it that much harder to leave your family on a regular basis when you're going to a job that you're not happy anymore doing. The term burnout gets thrown around a lot, and I feel like that's an unfair term because it appears to place the blame on the physician when they decide to quit. But what it really does, it deflects blame away from the folks that really need it, and that's the healthcare system itself and the people that are making the rules. And that's a much bigger can of worms dedicated to a series of videos that I'll discuss much later. So what's in my future now? I'm trying to figure that out. But one thing's for sure, I'll be making videos throughout the process, so subscribe and I'll keep you updated. Have a great day.